Alright, to start an IV, we're going to begin by finding the correct IV fluid for this patient. Not all IV fluids can be used on every single patient. Just so happens that this patient is going to require dextrose 5% in water. When I've selected the correct fluid that either the physician has ordered through a protocol or through the radio, I'm going to do several things. I'm going to make sure that it's correct fluid. I'm going to check to make sure that it's in date. I want to make sure that there is no particulate matter floating around. And I'll also give every bag a gentle squeeze to make sure that there's no leaks. If there is a leaking bag, it typically leaks right here where these pores come off. Alright, I'm also going to select the correct drip size for this patient. Now, every patient can have the same drip size. As you know, there are two broad categories, macro drip and micro drip, and you certainly do not want to use a micro drip on a patient who has had fluid loss. So I've now selected the correct fluid and checked it. I've selected the correct drip set and checked that as well. I always unfold the entire length of the IV tubing, check it to make sure that it's intact, because sometimes in the manufacturing process the tubing does not get fused well at the parts and it may come apart. So I've checked it, there are no kinks, no crimps, and I'm also going to go ahead and shut off the regulator so that I suddenly just don't start dumping fluid when I actually spike the bag. Alright, I've rechecked my bag for the 5 rights, and as you can see here, there are 2 ports on this bag. This port is an IV admixture port, and you would inject medications into the IV fluid through that port. This is the place that we're actually going to insert the IV tubing into the bag. So I'm going to pull off the blue cap, and this has to remain sterile. So now that I've uncapped it, I can't touch this or drop the bag. I'm going to take my IV tubing, uncap it, and this reveals the spike. The spike simply goes right into the center of that port. You push it, and I usually give it a twist as I'm doing that. You then invert the bag, and you want to fill the drip chamber. And you do that simply by squeezing it a couple, 3 times, and you want to fill it roughly halfway. Okay, once you've done that, you can hang your bag up or hand it to a bystander who can hold it. We then want to evacuate all the air out of the remaining length of the tubing. Now this port, this end of the tubing, is covered with yet another cover. Don't take that off until you're actually ready to connect it to your IV catheter. You can actually evacuate the air with that cap on. Simply turn the regulator on full blast, and you can simply watch all the air moving out of the tubing. Alright, once a few drops of fluid has fallen, I'm going to shake the excess off, and I usually hang this up. By hanging it up, it keeps the distal tip of your IV tubing out of the dirt and off the floor, and it stays less contaminated that way. Alright, next step, before you put on your gloves, it's always a good idea to tear your tape. You're going to need at least a couple of pieces of tape, and how you tape your patient is going to vary from patient to patient. I usually use a single strip of tape, and I'll tear it to roughly an inch, inch and a half width, and then about a 3/4 inch piece of tape, and usually hang it somewhere close that you can easily grab it. Sometimes you can even put it on your pants leg. Next in this process is to look and make sure that we have the correct gauge catheter that we're going to use on this patient. And again, if you have a patient that has fluid loss, hypotension, blood loss, you want to use a low gauge number, which means it's a wider, larger needle, and you can pour more fluid into your patient that way. Alright, so I've got the correct catheter, I've got my tape torn, I have my other equipment assembled, so I can go ahead and put my gloves on and get ready to actually start the IV on the patient. So once I'm gloved up, I'm going to select a vein. Once I've selected the vein, I want to go ahead and pull my tourniquet so that we can start filling the patient's vessels with blood. And in order to get the vessels to rise up above the surrounding skin, you can do things like thump on the vein a little bit to irritate it. You can have the patient squeeze his or her hand, which will enhance the filling of the vein too. All right, once the vein is properly exposed, we want to prep the site. So I've got an alcohol prep, and you really want to scrub the site down well. In fact, it's a very good idea to use not one but two alcohol preps when you're doing this, particularly if your patient's been out in the dirt and if there's dust and debris on the patient's skin. All right, once the site is cleansed, I'm going to uncap my needle, make sure that the bevel is facing up. Now I want to use my thumb to pull traction back on the skin. You want the skin nice and taut if possible. And people do this in different ways. Some people will actually go on top of the vein and insert it into the vein. Some people go to the side. It really makes no difference. It's just going to be your personal technique. But what you're looking for is a flashback, as it's called, of blood up here into the clear part of the IV. All right, so keeping the angle close to the skin, I'm simply going to insert it until I get that flashback. I'm then going to very gently thread the catheter over the needle to that point. Do not take this out yet because you'll get blood everywhere. Okay, so once we have a flashback and we're getting a blood return, it's now time to connect the IV to the IV tubing. So I'm going to take my IV tubing, I'm going to uncap the distal tip of it, and there's kind of a trick to actually doing this with minimal blood flow out of the IV. You want to take one finger, and it's usually going to be your ring finger, and press down on the tip of the catheter here proximal to the IV insertion site. Then take these other two fingers, grasp the hub, very quickly pull out and connect your IV. Then open it up to make sure that you have a flow, turn it down to the TKO rate. Then immediately take your sharp and dispose of it. Now, holding the IV site as stable as you can, we need to cover it because this is in fact an open wound. Most people these days use something called an IV op site, which is a nice little piece of plastic that's used to cover both the proximal tip of the IV tubing itself and the wound. It's clear so that you can see swelling that comes through. So simply place it on there. Remove the plastic part, but that's not an adequate stabilization of the whole IV. We're next going to take and turn a gentle loop into the IV tubing, and using the tape that we tore earlier, we're going to further stabilize the IV. Don't make this tape too tight, as you could create a tourniquet effect. And the final thing is, staying away from this Y connector, we want to create something called a tug tape. And the tug tape is used to take pressure off of the IV injection site. And if this tubing hangs on something as you're transporting your patient, all the force is exerted there rather than down here. Now at this point, we're going to go back, we're going to regulate the IV drip to get it to the rate that we want to administer to this patient, and then finally we're going to document.